Okay, so if you're watching this, I'm willing to bet you're in a lot of pain and you're looking for answers, like right now. A clogged milk duct is just so distressing. But the good news is, there's a modern, really effective solution. We're going to break down what's happening inside your body, and most importantly, show you a real path to relief. Does this look familiar? Or maybe feel familiar? That tender lump, that patch of redness, the way it just hurts when you're trying to feed your baby. Yep, these are the classic signs of a clogged milk duct, and it's a signal from your body that you really shouldn't ignore. And if you're feeling this, I just want you to know you are so not alone. This is one of the most common and frustrating challenges for breastfeeding moms. It's painful, it's disruptive, but let's talk about how to feel better, starting with figuring out what's really going on. All right, so let's start with part one, really understanding the problem. What is actually happening inside your breast tissue when a duct gets all clogged up like this? So, on a basic level, a clogged milk duct is what it sounds like, right? It's a blockage that stops milk from flowing the way it should. This backup is what's causing all that localized pain and swelling. And this is super important to know. If you don't get it sorted out, it can turn into a much more serious infection called mastitis. But here's the thing that modern science has shown us. And honestly, it's a total game changer. It's not just a simple physical plug. The real culprit is actually inflammation in the tissues around the milk ducts that's squeezing them and blocking the flow. So you might be wondering what causes this inflammation in the first place. Well, it can be a bunch of different things. Maybe feedings are a bit less frequent, or you're over-pumping. It could be a poor latch that isn't draining the breast all the way, or even just a change in your baby's schedule, as they start sleeping longer. Any of these can kick off that inflammatory response. So this is why it's so critical to understand that inflammation is the root cause. Because some of that traditional advice you might have heard, it can actually make things worse. Putting heat on it can just increase the inflammation. And we now know that really hard, painful massage can irritate or even damage those ducts that are already squeezed shut. The modern, evidence-based approach is actually the opposite. Use cold to reduce inflammation and avoid any kind of aggressive massage. Now that we get it's really about inflammation, we can talk about a modern, gentle, and incredibly effective way to treat it. And that is therapeutic ultrasound. Now, this isn't the same ultrasound you had during pregnancy to see your baby. This is a therapeutic treatment. It's completely non-invasive, it's painless, and it uses high-frequency sound waves to work deep inside the breast tissue, right where the problem actually is. So, how exactly does it do its magic? Let's walk through it. First, these really gentle sound waves are applied to the area. Those waves create tiny microvibrations and a deep, soothing warmth. That brings more blood flow way down into the tissue, which then helps reduce all that inflammation and swelling. And the results? The obstruction clears, and your milk can finally flow freely again. Okay, so that's the science behind it. But now for the part that really matters. How does this help you? Let's talk about the benefits and what you can really expect. The benefits are laser-focused on what you need right now. First and foremost, you get significant pain reduction because it gets the milk flowing again. By tackling the inflammation directly, this gentle, non-invasive approach doesn't just mask the symptom, it actually resolves the clog fast, which is so crucial for preventing a nasty infection like mastitis. I know what you're probably thinking right now. This sounds great, but how quickly does it actually work? And the answer is just so encouraging. Most women feel a huge difference and see the issue completely resolve after just 1 or 2 sessions. It's really designed to be a fast-acting treatment because, let's be honest, when you're in that much pain, waiting is just not an option. Of course, the most important question of all is about safety. Is it safe for you and for your baby? And the answer to that is a very clear, very confident yes. Therapeutic ultrasound for clogged ducts is completely safe. It has absolutely no effect on your milk supply or the quality of your milk. In fact, by getting things flowing, it just helps support it. So, if you're sitting there in pain right now, we've covered the what, the why, and the how. The last piece of the puzzle is getting fast, expert care. At OVA Women's Health, they have this simple but powerful principle. When you're in this much pain, waiting just isn't an option. They truly get the urgency, and their entire approach to care shows it. And that's exactly why they have dedicated appointment types to get you seen as soon as possible. There are priority appointments on weekdays to get you in within just 1 to 3 days, and then there are emergency appointments for weekends and holidays when you feel like you just can't wait. Look, this is all about getting you specialized care that's based on the latest evidence. The team is made up of pelvic health physiotherapists who have advanced postpartum training. They know exactly what you're going through, and they know how to provide that fast, effective relief you need. So what's the big takeaway here? It's that you do not have to just suffer through the pain of a clogged milk duct or risk it getting worse. There is a fast, safe, and gentle solution ready for you. If you need relief now, go ahead and scan this code to learn more or to book your appointment. The sooner you get care, the sooner you can get back to what really matters.